The cause of death was listed as a drug overdose, yet the medical examiner disagreed. The toxicology report indicated negative for opiates. The postmortem interval was estimated at 6 hours, but physical evidence suggested this estimate was inaccurate. An initial assessment revealed needle marks on the deceased's left forearm, consistent with intravenous drug use, leading investigators to initially suspect an opiate overdose. However, subsequent laboratory analysis of blood and tissue samples did not detect any opiates or other common street drugs. This discrepancy prompted a closer examination of alternative causes, such as synthetic opioids like fentanyl or benzodiazepines, which may have masked the presence of opiates due to their similar pharmacological effects. Chapter: Case Background. The incident under investigation occurred on September 15th at a private residence in downtown Manhattan. At approximately 9:45 a.m., a concerned neighbor reported noticing unusual activity outside the deceased's apartment for several days prior to the discovery of the body. On the morning of the incident, the neighbor observed no signs of life from inside and noted that the front door was slightly ajar. Upon closer inspection, they detected an unpleasant odor emanating from within. The neighbor immediately contacted local authorities, who entered the premises with due caution. Inside, emergency responders found the deceased lying supine on the bedroom floor, surrounded by empty prescription bottles and various unlabeled pill containers. The scene suggested a prolonged period of immobility. However, no immediate signs of trauma were apparent to the responding officers. Initial assumptions at the scene leaned towards an accidental drug overdose, due to the presence of multiple pharmaceutical substances scattered around the area. Tox screen analysis was prioritized to determine the cause of death and identify any potentially lethal compounds present in the deceased system. Chapter: Initial findings upon arrival at the residence. First responders noted an adult male found in a prone position on the living room floor. No visible signs of trauma or external injuries were observed, and the scene was consistent with a potential drug overdose. The deceased exhibited pinpoint pupils, suggestive of opioid intoxication. However, this observation alone did not definitively confirm the presence of opiates due to its nonspecific nature. Initial medical assessment revealed unresponsive behavior without respiratory effort. Scene conditions indicated no signs of forced entry or struggle, suggesting suicide as an initial manner of death classification. The absence of common depressant drugs, such as benzodiazepines and alcohol, in preliminary toxicology screening, prompted further investigation into alternative substances that may have caused the deceased's condition. Chapter: Forensic Investigation. At the investigation site, a systematic collection of physical evidence proceeded under strict protocols to maintain integrity. Recovered items included various pharmaceuticals and suspected illicit substances from the deceased's immediate vicinity. Notably, no opiate-based compounds were identified among these items. Additionally, traces of non-narcotic medication packaging and an empty bottle labeled for over-the-counter analgesics were collected. Environmental samples such as carpet fibers and residue from surfaces were also gathered to assess potential secondary contamination or indirect exposure. A comprehensive chain of custody documentation was initiated immediately upon collection, ensuring all evidence remained secure and unaltered throughout the forensic process. The absence of expected opiate traces represented a significant deviation from initial hypotheses regarding the cause of death, prompting further analytical scrutiny. The analysis of the deceased's biological specimens commenced with a comprehensive drug screen panel, employing immunoassay techniques to detect commonly abused substances. Initial screening revealed negative results for opiates, including morphine and codeine. To further investigate this absence of opiate presence, confirmatory gas chromatography mass spectrometry, GCMS, analysis was conducted on blood, urine, and liver tissue samples. The GCMS confirmed no detectable levels of opiates or their metabolites below the detection threshold of 1 ng/ml in any sample. Histological examination of the liver revealed no significant signs of opiate-induced hepatic injury or lipid accumulation indicative of chronic opioid use. Microscopic analysis did not identify any cellular anomalies specific to narcotic exposure, corroborating the negative toxicology findings for opiates. Analysis of forensic evidence indicates that the deceased ingested multiple substances prior to death. Toxicology results revealed no presence of opiates, but detected elevated levels of stimulants and sedatives. The postmortem interval was estimated through decomposition staging, rigor mortis assessment, and livor mortis examination. Entomological analysis provided a secondary timeframe corroborating initial estimations within a 12-hour margin. This timeline confirmed that the deceased had consumed substances hours before death and contradicted earlier speculation of opiate involvement. The sequence of events suggests ingestion of stimulants followed by sedatives, leading to respiratory depression and subsequent fatality. Corroborative evidence from scene investigation further supports this chronology. In the course of the toxicology analysis conducted on the deceased, comprehensive screening for opiates yielded negative results. This finding excludes opiate substances as a contributing factor to the death and narrows the focus towards alternative drug classes or potential non-drug causes. The evidence is conclusive regarding the absence of opiates in the system at the time of death, providing clarity that other substances must be considered. Interpretive analysis suggests a need for further investigation into benzodiazepines and synthetic drugs such as fentanyl analogs, which may present similar clinical symptoms but have distinct chemical profiles. Under oath, an expert toxicologist would affirm that while opiate presence can be definitively ruled out based on the forensic evidence, additional testing is warranted to identify any other substances that could have been involved in the fatal outcome. Interpretive analysis suggests a need for further investigation into benzodiazepines and synthetic drugs such as fentanyl analogs, which may present similar clinical symptoms but have distinct chemical profiles. Chapter Resolution: The comprehensive toxicological analysis of the deceased ruled out the presence of opiates as a contributing factor to their demise, marking a significant departure from preliminary hypotheses centered around opiate overdose. This determination was reached through rigorous screening using high-performance liquid chromatography coupled with mass spectrometry, HPLC-MS, which provided definitive negative results for commonly abused opioids such as heroin and prescription painkillers. Chapter Resolution: The comprehensive toxicological analysis of the deceased ruled out the presence of opiates as a contributing factor to their demise, marking a significant departure from preliminary hypotheses centered around opiate overdose. Initial assessments had suggested the involvement of opiates due to circumstantial evidence, including a history of substance abuse and signs indicative of respiratory depression. However, these assumptions were challenged by subsequent analysis that incorporated advanced analytical techniques capable of detecting even trace levels of drugs with high specificity. The absence of opiates necessitated a reevaluation of other potential contributing factors, such as benzodiazepines or novel psychoactive substances, NPS. This shift in investigative focus underscored the importance of thorough toxicological screening and highlighted the complexity inherent in accurately diagnosing drug-related fatalities. This analysis underscores the necessity of comprehensive toxicological screening in overdose cases, highlighting the importance of investigating alternative substances beyond commonly suspected drugs like opiates. The presence of other toxins or compounds can significantly alter the clinical picture and guide appropriate public health interventions. The file remains open,